When you do come in for our initial diagnostic assessment interview, all our clinicians would be going through a whole developmental history. Essentially, we would like to think around from childhood up until this stage, what are the major impairments that you might have faced both in education, your occupational history, your social history, and how have these affected you as a person? We also like to use a diagnostic interview schedule for adult ADHD, which adds into the clinical assessment and at the end would give a score regarding whether you actually meet the robust diagnostic criteria for adult ADHD, and if not, then what is the reason for certain impairments or symptoms. The whole interview would usually last around 90 minutes, and in that there would be a discussion around various life stages, various challenges you may have faced, and perhaps look at a common theme of pervasive inattentiveness, distractibility, or impulsivity, and how these have presented at various stages of their lives, and how their presentation might actually change as you go along your various life stages. At the end of the assessment, the clinician would be able to give a diagnosis of adult ADHD if you meet the criteria, or if not, then discuss around making a collaborative management plan that what could the next steps be. Patients who are diagnosed with ADHD have different impairments. ADHD presents differently perhaps in terms of the impairment it causes in different individuals. Our role as an ADHD specialist would be around identifying how to adapt your management plan to your particular needs. So for example, it could be that your ADHD consultant would have to write a letter of support to a university or to employer around adaptations which could happen in higher education or employment. But then when thinking around the treatment, as ADHD specialists, we tend to use the latest international guidelines and research to direct a management plan. The use of ADHD medications has been well studied internationally for a number of years, and these medications have been used the world over in different age groups across the board. What we'd like to reassure you is that your specialist would be able to form and guide in terms of the choice of medications with you, looking at any physical health comorbidities you may have, looking at the pros and cons of various medication and dosage options, and then forming a management plan which is best suited for your needs. Apart from the pharmacological treatment, one of the other roles is the use of psychological treatment, and we have the options of ADHD coaching, we have the option of behavioral therapy, as well as a mindfulness program available within our service, which your ADHD specialist would be able to discuss and perhaps suggest appropriate interventions for you.